This is Marla Vannucci, and I'd like to give you an overview of an article co-authored with Sharon Weinstein entitled The Nurse Entrepreneur: Empowerment Needs, Challenges, and Self-Care Practices. Nurse entrepreneurs fill gaps in the current healthcare delivery system by supporting the development of targeted products and services, enhanced technology, software, and safety systems. We now see more nurse entrepreneurs than ever before. As more nurses move beyond the bedside to explore entrepreneurship, it is important to learn about the unique challenges that face nurse entrepreneurs and how nurses have shifted perspective to make the transition, including the need for self-care. In our study, 44 nurse entrepreneurs reported on their transitions from employment to entrepreneurship, key motivators in the decision to start a business, and the challenges they face as entrepreneurs in the healthcare field. Additionally, they completed the 33-item Mindful Self-Care Scale Short, which measured 6 types of self-care activities and behaviors. Overall, nurse entrepreneurs reported more frequent self-care practices than a norm sample, and nurses later in their careers tended to report the most self-care. Empowerment was a theme that emerged over and over again as motivation to pursue entrepreneurship. Structural empowerment factors, or push motivators, are factors that push an individual out of employment, such as lack of financial gain or mobility, few job resources, a negative work environment, or organizational constraints. Psychological empowerment factors, or pull motivators, pull an individual toward perceived gains or benefits of entrepreneurship. These include things like personal fulfillment, growth, having an impact, and greater control or autonomy. Although participants reported both types of motivators as important, the pull or psychological empowerment motivators were far more critical in the decision to start a business. Challenges, such as juggling multiple roles in a business, balancing one's own needs with those of others, balancing family and business needs, and time management, were associated with fewer self-care behaviors. Social support, both professional and personal, was identified as key in overcoming these challenges. Nurse entrepreneurs often start their own businesses to avoid the stressors they previously experienced in the employed work environment. As opportunities for nurses evolve beyond the traditional role, it is important to understand what motivates this shift, what challenges exist, and how nurses can sustain their success through effective self-care. Future research should compare nurse entrepreneurs to nurses in other roles and, additionally, evaluate the effectiveness of reported self-care practices when compared to measured experiences of stress. Thank you, and we hope you find our article informative.